Do you notice when you eat lots of salads and vegetables and higher fiber, you feel better or worse? Have you experimented with psyllium or citrusel or what have you, a fiber, and noticed it was helpful or not? That can cue you in on what to do, not the test. And again, case in point, because depending on the test that you did, you may be told to go high fiber prebiotic or you may not. So the testing is really falling short here in terms of helping us. Hey everyone, what is the best functional medicine stool test? Well, to help answer this question, we have split test two of the best tests in the field, and I think the results will shock you. Let's unpack and then help you understand what is the best path, including or not including testing, to improve your gut health. And just to clarify, what a split test is, what it means is that we took one bowel movement from a person, we put half of that stool into one test kit and the other half of that stool in the other test kit. So we're comparing literally the same stool sample across two different tests. We should see the same exact thing. This is what's so valuable about split testing is it's one method of assessing, is there consistency across different tests? Okay, so we've done this 2 times. Let me share sort of patient 1 split test with you first. What you're seeing here, and in case you're not watching, I'll narrate through this. On the first test, you see high candida. Second test, normal candida. Then you see high akkermansia on one test and normal on the other. You also see high Klebsiella and Pseudomonas on the one test, and those are normal on the other. And then finally, you see on the one test, the normal zonulin, and on the second test or the other test, high zonulin. And it's this sort of disparity which leads me to recommend not treating stool test results and using this axiom to guide us, which is if you're treating stool test results, you're doing yourself or your patients a disservice. And I say this as someone who for many years did just this, but I want to walk you through sort of my thought process and what I've learned over the years. Now, the quick backstory is when I was in college, my health fell apart. I had a parasite, it turns out. It took me a little while to figure that out, but a stool test helped me to determine I had amoeba histolytica, which is a very pathogenic parasite, a true parasite. And this pathogen kills people due to dysenteric death in third world countries. Sometimes the term parasite is used sort of flippantly. Oh, you've got a parasite. You must have a parasite. Blasto or E. nana are parasites, which they are not. Amoeba histolytica is a true parasite. I had it. It was not pleasant, but it diverted my career to do what I'm now doing. So in a way, it was beneficial. Now, because of my personal experience, when I was in clinical practice or earlier in my career, I would run 2 tandem stool tests on pretty much every individual. Now, if you factor in the fact that I was seeing 4 new patients per week and seeing patients 2 days per week, that's about 400 tests per year. And I did this fairly meticulously for about 5 years. So that's about 2,000 plus stool tests I've examined. And I can tell you with a very high margin of confidence that it's rare that you see 2 different tests agree with one another. It took me a while to sort of piece this together, but through time, through observation, through fact-checking some of the labs, and in the process of thinking about what do these tests really tell us, I've come to change my perspective on stool testing, and now I generally recommend against it. To be careful, there are exceptions to this. If you're presenting with acute diarrhea or other symptoms and your conventional provider is recommending to do a test, always divert to the recommendations of your doctor or your healthcare provider. However, when we go from this sort of acute presentation to more of a chronic one, this is where the rules of the game change. Stool testing was really validated to help determine, does this person have a infection that requires antibiotics, or might they have something that's self-limiting, or might they have inflammatory bowel disease? And what's happened is the validation in that context of acute gastroenteritis has bled over into the functional field, well-intentioned, and I was doing this for 5 years plus myself, so it's not a criticism. But to think that the person who has some constipation, some diarrhea, some food reactivity, some insomnia, some joint pain, some brain fog, whatever it is, we've got to do a stool test so we know what to treat. But again, I bring you back to these test results. Depending on what doctor you saw or what test he or she used, you could have totally different results and therefore a totally different care plan. And let's just sort of walk through this. On the one test, it was found there was high candida. Now, candida is actually a normal resident, and it's often not a problem unless it overgrows or becomes dysbiotic, and then it can cause issues with immune system reactivity. Now, depending on where you went, what test you did, you may be told, oh, you have candida, we've got to go low carb, low sugar, and use antimicrobials. Or coin toss, different test, no candida, nothing to worry about. So one case in point where treating the test would actually be a huge disservice because we don't know if the candida is actually present or not. We move over to Akkermansia. And Akkermansia is this mucus-loving bacterium that does promote health through a few main mechanisms, but one is through stimulation of toll-like receptor 2, which helps close the tight junctions and combat leaky gut. So this is good. And also through stimulating GLP-1, which is glucagon-like peptide 1, it may have an anti-obesity effect. Now, depending on what test you did, your healthcare provider may say, well, we've got to go on a high fiber, high prebiotic diet. We want to feed the Akkermansia. And as you hopefully are accustomed to me criticizing, that sort of high fiber, high prebiotic approach will help some, but it will flare others. And if I had a dollar for every time a patient said, we treated my labs and I felt worse, because you see this oftentimes. You see some aberrancy in healthy bacteria and the reflexive recommendation, which is totally disconnected from the person and their history and their symptoms, to go high fiber, high prebiotic. It works for some, it flares others, and there's a much better way to determine if someone needs higher fiber and higher prebiotic. Listen to the person, right? Do you notice when you eat lots of salads and vegetables and higher fiber, you feel better or worse? Have you experimented with psyllium or citrusel or what have you, a fiber, and notice it was helpful or not? That can cue you in on what to do, not the test. And again, case in point, because depending on the test that you did, you may be told to go high fiber prebiotic or you may not. So the testing is really falling short here in terms of helping us. Now, we come to the two other bacterium that are dysbiotic, Klebsiella and Pseudomonas. Both are normal residents, but they can both be problematic. When Klebsiella overgrows, it may trigger a attack against collagen in the gut, which is why it's correlated with Crohn's. And Pseudomonas, when it overgrows, may function as an opportunist and in part participate in the formation of biofilms. But again, we don't know if someone actually has this or if they don't, because the testing is so inconsistent. And look at this even further yet still. Test 1 is probably a worse test because you have high candida, high Klebsiella, high Pseudomonas. But look at this. Test 1 had normal zonulin, normal stool zonulin. I'm going to loop in why that's so important in just a second. And then the second test was a much better test, but this test has high zonulin. So this should be a little bit counterintuitive, and I'm sure there's many clinicians who are sort of nodding their head in agreement. As I've noticed, it's been hard to tie stool zonulin results to someone's level of symptoms. And here is part of where that comes from. Oh, and by the way, please like or comment or subscribe if this has been helpful. I'd be curious to hear your thoughts. And also by doing so, you help us get this important information out to more people. Okay, so here is really seminal meta-analysis 2023. The key finding, and then I'll add in a few details. Treatment with probiotics resolved leaky gut. This correlated with blood zonulin, not with stool zonulin. This is probably why we see this disparity where the one stool test that looks worse had normal zonulin, the other stool test that looked better had high zonulin. Remember, this is the same patient. Not only is the same patient, it's the same stool. And zonulin, aka zonulin family proteins, indicate if leaky gut is present. This is probably the most accurate way of assessing leaky gut, so it is an important marker. And just as a quick reminder, zonulin is probably the most accurate marker of leaky gut, but important to clarify that most of the research is looking at blood zonulin, and hence the point here. So coming to this study, again, this is a meta-analysis. They found that probiotic supplementation can rectify microbial homeostasis, so balance out dysbiosis and or SIBO, which we've discussed so many studies on the podcast in the past that document this. But not only that, they measured endotoxin, so direct leakage or leaky gut, the particle that leaks through, the LPS, and also the cytokines that are an intermediary in the leaky gut process, namely tumor necrosis factor alpha and interleukin 6. And they documented that as the probiotics improved homeostasis, they reduced leaky gut, they reduced inflammatory cytokines, and it led to a lowering or a normalization of blood zonulin, and there was no correlation with stool zonulin. So as we're learning more, and as we have better study and more data, I think we need to sort of evolve away from some of the early thinking that we need to be doing serial or screening with stool tests to help get our patients healthy. Now, I said we did this on 2 different individuals. So here is the second individual stool test. The thing I find the most striking about this is Clostridium difficile was high on one test and normal on the other. Now, C. diff is a normal or can be a normal part of the flora, and up to 47% of people will have C. diff with absolutely no problem and will be what's known as asymptomatic. It's important to understand this because once we start using stool tests as these broad screening tests, we should be careful not to overtreat. And this happens in some individuals. Let's say someone has some mild food reactivity, brain fog, and skin issues, and they're wondering if it's coming from their gut. Their healthcare provider sees C. diff on a stool test and comes in guns a-blazing with antimicrobials. In fact, we'll share just a quick screen grab from a case study. A patient was working with a different functional medicine clinic and was getting hammered with antimicrobials because of their C. diff and was getting worse because of it. And when they came in to work with us, we pivoted to probiotics. All their symptoms went away. So again, I don't know all the context of your situation, but it's important to mention that unless someone is presenting with fairly recalcitrant and notable marked diarrhea, then they may not need to treat the C. diff. So we want to be careful on the one hand, and then on the other, look, depending on what test you did, you may be told you have C. diff, or you may not be told you have C. diff. I'll state again, my axiom that's taken me many, many, many years to learn my way to, which is if you are treating the stool test results, you are doing yourself or your patients a disservice. What I would recommend doing instead is experimenting with the interventions that can improve gut health. And when you improve, do more of that. And when you don't, do less of that. And there's really 4 therapies, 4 tools that I found will resolve issues if it's emanating from the GI in 75% or more of individuals. Diet, probiotics, elemental dieting, and herbal antimicrobials. Now, the diet piece is a controversial one because people have all sorts of thoughts on what diet is the best. I'll just say this. If you're on the right diet for your gut, you'll see improvements usually within 2 to 3 weeks. And there's 2 general approaches. One, a basic elimination diet that focuses on food quality and cutting out common triggers. I think a relaxed paleo template is a great place to start. You could perhaps argue for a Mediterranean diet. I think it's less important the specific diet. It's more important that you focus on whole, fresh foods and reduce common irritants like gluten, grains, and processed foods. Not forever. Those foods will not be a problem for most people as they improve their gut health, but as a starting point to eliminate and then reintroduce. Now, again, 2 or 3 weeks, that's either helping or it's not. If it's not, trial a low FODMAP diet. And again, if that's helping, you'll know within 2 to 3 weeks. And whatever diet's helping, continue. And if diet's not helping, then the issue may not be diet. And I said way back in Healthy Gut, Healthy You, be careful not to force a dietary solution to what might not be a dietary problem. So step 1, diet. And by the time you went in, picked up a stool test, brought it home, performed it, sent it in the mail, it got to the lab processed it, and then you had a chance to discuss it with your healthcare provider, you could already be well into this experimentation and maybe even moving on to step 2, which is probiotics. Again, this is pretty simple and pretty straightforward. There's 3 general types. There's your very traditional lactobacillus and bifidobacterium blend. Alternatively, there's Saccharomyces boulardii. And alternatively to that, there's a soil-based probiotic, some type of bacillus species. You can try one, you can try all 3. Just depends on how strong of a probiotic protocol you want to use. But if a probiotic is helping, you'll know within 4 weeks. And recent research is indicating that people will pinnacle from probiotics usually by the 2nd to 3rd month. And then depending on how those are helping you, if not completely, you can then do a reset with an elemental diet. And then finally consider herbal antimicrobial therapy. Why this is so much more effective is because these interventions will help with pretty much all of the things that the functional stool tests are assessing. And as you've seen, assessing in a really inconsistent fashion. If you have leaky gut, IBS, or IBD, we know that dietary changes can help with all of those. In fact, further yet still, a low FODMAP diet can even reduce levels of gas. So many, if not most, of these issues can at least be helped to some extent by diet. Probiotics can combat SIBO, Candida, we shared leaky gut, can reduce IBS, can reduce IBD, and may even help with things like cognition and skin. Elemental diets have been shown to combat SIBO, IBS, IBD, and may even help with distal involvement, things like rheumatoid arthritis. And then finally, herbal antimicrobials, some systematic review and or comparative meta-analyses have found that herbal therapies are as effective as many IBS or gut-mediated pharmaceuticals, whether they be for constipation, antispasmodics for IBS, or even antimicrobials for SIBO. So, because these natural agents will impact many or most of the markers that you test for, it's much more expeditious and intelligent to just trial the therapies and build your own protocol in a stepwise fashion and save the money and save the time that you would spend and use for the testing, while realizing that the testing results are very inconsistent and you're more likely to get a care plan that's targeted toward the test results and not toward you and what your system needs. And again, when you understand and you see how inconsistent the results are across tests, you see how important it is that we shift our paradigm from one of treating the tests to one of treating the individual. With the exception if you have an acute issue And then this is where conventional medicine does a great job in helping determine what path you should take. Again, if this has been helpful, please share and also comment. I'd be very curious to hear your experience. This is Dr. Michael Ruscio. Hope this helps.